is being an antibiotic steward to your outpatient pediatric patients. So there are many practitioners out there that are overprescribed antibiotics, and frequent exposure to antibiotics for lead to resistance. So meaning that when they need it most, the antibiotic, they will no longer be effective. So this practice can also lead to like Clostridium difficile infections and other drug adverse events and organ toxicities, allergies, and rashes. So sorry, right now I'm at the airport. So per the Centers for Disease Control, antibiotic resistance microbes result in like 3 million infections and 35,000 deaths yearly in the US apparently. So from the pediatric 2011 and 2015 National Electronic Injury Surveillance System, the antibiotic-related drug events accounted for almost like 50% of the emergency room visits. CDI is another one, and it accounts for like 71% of it, and related to mostly from like otitis media, ear infections, sinus infections, or acute respiratory tract infections. So there are 50 million antibiotic resistance in the ambulatory setting, and half are considered pretty much inappropriate. So if you're not sure about what to do, order during a clinical visit, always consult the infectious disease professional and him a part of your antibiotic stewardship to provide quality care to your pediatric patients. So things you can do to avoid, but not limited to prescribing antibiotics, include number one is watchful waiting, for example, for an acute otitis media. Number two is like follow up negative culture results and discharge antibiotics that were initiated initially. Number three is although this strategy takes a long time, and some parents will tend to harass their practitioners. I mean, that's kind of harsh, but that will like insist on what they want, which is pretty common because a lot of parents do have to go to work, and they always say, no, why don't you just cure them with an antibiotic? And you kind of have to explain to them that this is a common cold. So education is the key always. Kind of just be firm with them, but also support them as well. Make sure that they understand what you're doing. Explain to them the course of viral and or bacterial course of illness, i.e. prolonged cough for example, viral pharyngitis. Number four, for someone with pharyngitis, reserve the antibiotic if they have positive strep throat. Number five is for someone with sinusitis, diagnose it appropriately and treat appropriately. Number six is also make sure that you prescribe the first line of antibiotic treatment for that particular illness. For instance, like amoxicillin for an acute middle ear infection instead of azithromycin. But then again, it really depends on where you are practicing. Some clinics don't have a particular type of antibiotics, and so you kind of have to go the other route. Number seven is consider a shorter duration of therapy instead of like prescribing antibiotics for 10 to 14 days. And of course, make sure that it does make sense, and i.e. like skin and soft tissue infections, pneumonia, and like urinary tract infections. You took an oath to provide the best quality care for your patients, even though sometimes the business end of healthcare does not allow you to do that. Again, thanks for watching, and I hope this helps being an antibiotic steward for your patients. And if you have any questions, always, you can ask me, of course, but you always have to ask the people that are around you. And this is just all my advice to you, and you can always, decide on this advice that I have provided. So I'll see you guys again in the next adventure. Thank you.